Voice.
It,
All right. Great Wednesday. Great spring. This is Naya Powell, and I am the founder and CEO of Utopia Global Wellness. Super excited to have today's Utopia talk and our guest, Dr. Delana Wardlaw. Today, we're going to be talking about springing into well being and also the impact of stress on our well being and our gut health. So, we're seeing all this talk about gut health. And so, the reason why we're seeing all this talk about gut health is because it's directly correlated to something that is an epidemic in our current society, which is stress and burnout. So I am so delighted to be here today with Dr. Delana Wardlaw, and she is Pennsylvania. She has been named Pennsylvania's #1 family physician, also known as one of the twin sister docs, and also seen on GMA, People Magazine, and so many other platforms. So, Dr. Wardlaw, where are you joining us from today?
I am joining you from Philadelphia, Pennsylvania. Thank you for having me.
All right, Philly in the house, Philly in the house. So, so this is really a delight. Dr. Wardlaw is family. I lived in Philly for a short period of time growing up. My mother's from there, so I have an amazing family in Philadelphia. And Dr. Wardlaw and her sister have just been doing incredible work that has been recognized nationally and internationally for their contributions to their community, and a lot of that being around COVID. So we're going to dive into a little bit more of her background, what inspired her to be in a physician, and then today's topic around the impact of stress on our well-being. But before, I just want to share a few highlights, a few Utopia Global Wellness highlights, and some of the things that we have going on that are new and so exciting. So some of you may or may not know that we have a new partnership with United Healthcare, so one of the nation's largest health plan providers. And that is exciting for us. And what does that mean exactly? That means that any plan holder of United Healthcare can have free access to Utopia Global Wellness, our digital wellness platform that offers globally relevant, culturally relevant, comprehensive, integrative, and holistic health solutions. So that's spanning from mental health and nutritional coaching, emotional wellness coaching, mindfulness meditation, yoga, Tai Chi. We have seated yoga and seated Tai Chi as well. We also offer a new HIIT class starting this Friday, and we do a lot in the space of workplace wellness. So we have a whole series of workplace wellness workshops that touch on the topics that we're going to talk about today: strategies to reduce stress and anxiety, boundaries to prevent burnout, how to create a more inclusive, mindfully inclusive work environment. So we really sit at the intersection of holistic well-being, the future of work, and mindful diversity, equity, inclusion, and belonging. So something every organization needs, right? So we're not here. We don't have we can't obtain wealth, and we can't function well if we don't have our health. So we are here for that. Also want to share, this is like a really, I would say, a monumental month for us. We didn't realize we had so many things planned. But of course, we're kicking this off. This is World Health Week on Friday. So this is so timely. And so we have this Utopia talk followed by a United Healthcare and our physician and healthcare partnership lunch and learn tomorrow at 11 a.m. You can sign up for all of this stuff right on our website under the events page. We have our global book club, our finale discussion. We're reading Michelle Obama's The Light Within, which really talks a lot about her journey around mental health and overall holistic well-being, very in alignment with our 30 Days to Utopia Living book as well. And then we have our final registration days for the Bali retreat that we have coming up September 2023, our global spa and wellness retreat for women leaders and CEOs. And every woman is a CEO of her life and her home. And so we are all leaders. I just want to put that out there. And we have our overall United Healthcare partnership lunch and learn. If you just want to learn all about it for your organization, we do have 2 plans that we support. That is OnePass, which is the employer plan. So there are many companies, FedEx, I believe Coca-Cola, Home Depot, many companies that have United Healthcare as their plan holder. Again, you don't have to pay anything out of pocket, and you can be a part of our community and enjoy all of our live classes and our on-demand classes, which we have over 500. And then the Renew Active plan. I'm very proud of this plan, being a part of this plan, because this is our Medicare, Medicaid population in underserved communities that don't always have the best access to care and especially holistic wellness offerings. So wanted to share all those really amazing things. Again, upcoming events, or if you want to RSVP for those or read more, just check out the link right there in the chat. And let's get into it. So, Dr. Wardlaw, I just love to hear your, in the entrepreneurial world, we call it our founder journey, but I would love to hear your medical journey. What inspired you to even pursue medicine? Did you have doctors in your family? Were your parents or grandparents physicians? What was it that inspired you and your sister to take this journey?
So my sister and I, my sister is the other half of twin sister Docs, and she is my identical twin sister, of course, and as Dr. Elana McDonald. We are first generation physicians. So we did not have any physicians in our family when we started our journey. And becoming a physician was not my first choice of,
Mm,
of a career. I initially wanted to be an elementary school teacher. But as you go through your journey, you realize very quickly what your strengths and your weaknesses are, and realizing that some things just are not for you. And I realized early on that I really did not have that skill set to teach the younger population. As I was reading to my nieces and nephews, I didn't have the capability to be able to tell them how to decode a word or how to be able to pronounce the word out. I just want to say conscious, like don't like so I said, well, this is probably not for me. And so, but what was I realized that I had a strength in math and science,
mhm,
but my why for going into medicine, at the age of 53, my maternal grandmother died of breast cancer.
mm,
And we all know that breast cancer is a disease that has a high survival rate if it is detected in early stages.
right.
However, due to lack of access to quality health care, and as well as also a mistrust in the federal government and the medical establishment, my grandmother did not have the opportunity to be diagnosed in an early stage. And she lost her life at 53, and she may have lived an additional 30 years.
Absolutely.
And for me, we were 8 years old when my grandmother passed away. We had no idea why grandma passed away. We didn't realize that she had breast cancer. We didn't realize that she had both her breasts removed. We didn't realize that she was getting treatment. We just knew that one day we walked to the hospital at age 8 years of age, saw grandma laying in the bed, and then we never saw her again after that.
Oh my goodness.
And so we did not realize what grandma died of until we were in high school. And
Mm,
that was my driving force as to why I wanted to go into medicine. So
mhm.
that if I had the capability to be able to help people, to be able to impactfully help them save their lives, and that is what I wanted to do.
Wow.
And for me, it has always been my driving force to not only give back to the community, to make sure that we are in a medical sense, making sure that I have the capability to be able to reach out to my community and my office, outside of my office, but also to be able to reach back to the upcoming future budding scientists,
Yes.
and be able to provide that mentorship for them, to let them know that they could too be physicians, whatever it is they want to be,
Mhm.
because the numbers in medicines haven't changed, and we could talk about that in a little bit. But
Yes.
there's a lot of work to be done. There's a lot of work to be done.
Right. That's
Mhm.
such a powerful story. And I always think it's incredibly inspiring when something that, maybe was a source of pain, where we use that and channel that into, something powerful and impactful. And that's exactly what you and your sister did. And was it was it kind of a moment where you both sat down and talked about it, or how did you both decide to pursue this journey together, which I think is so special. I always wish that I was a twin, but it's one of those things, either you are or you're not.
Well, Dr. McDonald, so she wanted to be an attorney.
Okay.
So again, medicine wasn't her first choice either, but she participated in summer program where she worked in an attorney's office, and she realized that that wasn't something that she was really interested in, and she decided to follow her sister and to go into medicine. But again, she looked at her strengths and her weaknesses as well, and she journeyed into medicine as well. And so that pivotal point of her participating in a mentorship program that gave her the opportunity to realize that, okay, this is not all what I think is chalked up to be, and gave her the opportunity to realize that this is, I would like to change make a career path change.
Right. And so I think that's so powerful. A little over a week ago, I had the privilege and honor of attending the National Medical Association conference in Washington, D.C., and sitting in a room full of physicians, and primarily physicians, and healthcare leaders and policymakers, and even having an opportunity to go to the Capitol and hearing all of the different perspectives around health equity. And one of the things that came up was like workforce. And the other thing that came up was the need for more mentorship. And so, hearing you talk about your journey and knowing that there is a gap, and knowing that we need to have more physicians of color and more Black physicians, of course. We need more physicians in this country, period. More people going to medical school, because health and well-being is not something that we're ever going to not need, right? And so as you talked about communities of color needing to see people that look like your grandma, having physicians that look like her could have made her feel more comfortable going to the doctor. And it is something that we struggle with in our communities. And you and your sister have really been instrumental in that. So I would love for you to just take a few minutes and just even share with us ways that you help your community feel more comfortable, your patients feel more comfortable, and just even speaking to communities of color around why it is so important for them to get their checkups and go to the doctor and all of that.
So it's wonderful that you had the opportunity to experience the National Medical Association, or the NMA, which is in the early days, there was the American Medical Association, which did not allow African Americans to join.
Right.
So African Americans had to form their own association, which is National Medical Association, which still stands today as a support factor for African American and or minority physicians. It provides support and mentorship and as you journey through medicine, because as an attending physician who's been in medicine for the last 20 years, I still need mentorship. And I have a group of mentors that I depend on, that I can reach out to and ask questions, whether it's a billing question, whether it's a practice question. So that mentorship, it continues. And for me, and my sister as well, we had the opportunity to participate in a phenomenal internship when we were undergraduate students in our junior year of college at Temple University with Temple Owls. And we participated with the Medical Society of Eastern Pennsylvania, which is the local arm of the NMA. And during that internship for 8 weeks throughout the summer, we were able to rotate through the practice, whether it was the practice, whether it was the hospital, whether it was the operating room, whether it was the nursing home, wherever the physician spent their day, we had the opportunity to spend our day. And it gave us a bird's eye view as to actually what medicine entailed: long hours, tons of paperwork. So there is, although it is a career that I appreciate and that I would not change, there is some red tape in medicine. And so we had the opportunity to get that bird's eye view, but also knowing that there were people who had already paved the way. There were people who had already gone through this journey. And because we are first generation physicians, we didn't have anybody in our family to turn to. So that was pivotal for us to make that connection. And those mentors, many of those physicians that we connected with in 1994 are still our mentors today.
Wow.
We still see them at the Medical Society of Eastern Pennsylvania meetings. The National Medical Association will be here at the end of the month. I'm sure I'll see plenty of them there. So
you're going to New Orleans? No, are you going to New Orleans?
There's a meeting here in Philly.
Okay, got it.
At the end of April. Okay. And so that connection is key, and it allows us to be able to connect with people who know the struggles that we go through, know that our path is different from other people's paths, and they're there to help you walk that path, be able to give you advice, and to give you resources.
Mm-hmm.
Resources are always key. And so for us, Dr. McDonald and I, the twin sister docs, our mission is health advocacy, health wellness, and also making sure that we provide that mentorship, right? So during that was how our mission started out. And then COVID landed on our doorstep. And so COVID was the 800-pound gorilla in the room that had to be addressed. And so Dr. McDonald and I used our platforms, and our part of our mission is to meet people where they are. Mm-hmm. So during COVID, when we were on shutdown, we met people through the internet. Our offices were closed. We were doing telephone medicine. Our office doors were literally locked.
Right.
And so we were seeing patients through the virtually on the telephone, and we used our platform. We would do Facebook Lives. We would do Instagram Lives to answer the multitude of questions that were coming out about COVID. And we didn't have all the answers because we were flying the plane as we were building it.
Right.
COVID caught medicine off guard. And so we were caught off guard, but we knew that we had more information than the general population. And so we were willing to provide that information and to combat the tons of misinformation.
Speak to that.
The tons of misinformation, because, you know, with the internet and social media, misinformation is just rampant. And, you know, people use Google as their source of knowledge a lot of times. And what I tell my patients all the time, you know, anybody could post anything on Google. I can say at 2:00, a purple moon is going to fall out the sky. Mm-hmm. There's probably going to be two people standing outside at 2:00 waiting for the purple moon to fall out the sky. And so, you know, I say, you know, have to be careful and being able to weed out the poor things that are not legitimate, and be able to look up know what a legitimate resource is. And because, you know, the internet is a good resource, but you have to be able to use it appropriately. And it is misused in many ways. And so our goal during this shutdown, during this COVID, as it was, the information was changing so rapidly, so everything was fluid. Mm-hmm. And so, you know, Dr. McDonald and I, we would get caught up on all the latest updates, all the changes, and we would present that and give people the opportunity to ask questions. That is what's key, to give people the opportunity to ask questions, because you can talk, and if they are really not given the opportunity to ask a question, to really be sure that they understand it, a lot of it is missed. And so, and that works and that works in our offices as well. Mm-hmm. You just can't go in and talk to the patient for 10 minutes and then walk out the door. Why you have to talk in a conversational tone, in a non-judgmental tone, and talk to people and give them an opportunity to ask questions. That makes people feel welcome. That makes people feel like they are a part of the team. Right. And so it makes people feel like you care, right? Because here's what I learned, and I'm paraphrasing someone else who stated this: people don't care what you know unless they care that you care, and that's the bottom line. And so Dr. McDonald and I, we used our platform to provide education about COVID, and we knew that there was going to be questions about the vaccine. Mm-hmm. There's still questions about the vaccine, so we wanted to provide that information and that platform, just so we could try to keep everybody in the loop and keep people educated. And that's what we do. And so we used our social media platforms, particularly for our younger generation folks. And then we also do a radio segment that we do every Tuesday morning to provide updates, to give people an opportunity.
How can people listen into that?
It's called Word 900 AM. You can listen to it online. It's 900 AM or either 96.1 AM here in Philadelphia. But you can also listen to it online. And we're on every Tuesday morning.
Okay.
With Solomon Jones with Wake Up with Word. And we are on every Tuesday morning at 7:40.
At 7:40. Okay. So you all are committed on a weekly basis and beyond. Yes. I love it. So this is fantastic. And I think it's really relevant, Dr. Wardlaw, because we're over 3 years into COVID. And so I think a lot of us maybe feel as if COVID is gone. Unfortunately, COVID is not gone. And in a spirit of transparency, I went 3 years without getting COVID. I have traveled around the world. I have been to numerous conferences. I got my vaccinations, my boosters, and all of those things, which probably is why I did not get it in the first 3 years. But guess what? I got it. I got it a little over a week ago. And so while I know my symptoms are much more mild than many of the symptoms that I've heard, I believe a lot of that is a testament to me doing what I could do in terms of getting vaxxed and boosted and all of those things. I'm a little coffee because I'm still recovering. But I want to say that, so I want you all to know that COVID has not gone away. But there is a really big COVID, I think, announcement that some people may or may not be aware of. And then we'll, maybe demystify COVID a little bit, and then we'll move into the topic about stress and the impact of that on our well-being and gut health. But the government is, quote unquote, I guess, what are they saying? The government has decided from a federal perspective that they're going to end the pandemic from a perspective of care in terms of some of the care that's now paid for, in terms of how the government covers some of the care and things of that nature. Can you speak to that? What is going to happen, and when is that date? Because it's approaching.
So when we went into COVID, we went into an emergency response phase, meaning that the government, they shouldered all the costs for vaccines, they shouldered all the costs for medications, they shouldered all the costs for hospitalizations, and throughout the emergency response. Now, the emergency response is ending in May, and I believe it's May the 19th. And after May the 19th, federal funds will not be available for vaccinations and treatment for COVID. So those who are uninsured are not going to be able to get vaccinations. You can receive antivirals if you test positive for COVID, and if you're at risk for developing complications. There's a medication called Paxlovid that many people are aware of, and so you're able to get that without a cost. You're able to get your vaccines without a cost. That is going to go away when the emergency response goes away, and so people need to be aware of that. In addition to that, during COVID, people were not required to re-enroll and to receive their Medicaid benefits. Well, that is going away also. So if you have not updated your address, your income, and provided all of the information that Medicaid needs to re-enroll you into Medicaid, you could lose your benefits. So what I say right here on this call, if you are a Medicaid recipient, which many of us are, we need to make sure that you have been in touch with your case manager, you've been in touch with your county office to make sure that you have all the information that needs to be provided so that your Medicaid will not be lost. That is very important.
Thank you for sharing that. That is very important. That is very important. So for those that just feel and have been led to believe you don't have to wear a mask anymore, I would say be very cautious and could still take precautions as you're in group settings and in different environments in the public, because as Dr. Wardlaw just shared, a lot of those insurance benefits, a lot of those coverages that we've become so accustomed to. What about being tested? Will testing still be available? Or will it be something you have to pay for?
So that if you don't have insurance, that is going to be something that you'll have to pay for as well. So this is a big situation that is coming upon us, and many people need to be aware of that. That, coupled with the fact that people can lose their Medicaid, that's huge. So we need to make sure that people are aware, and I'm glad we're having this conversation tonight so that people can make sure. And you don't want to lose your benefits just because your information isn't updated. No, right? And there are some people who may lose their benefit for legitimate reasons. Many people's businesses took off during COVID. They've had a change of life perspective, and they have a higher income, which doesn't qualify them to be able to get those same Medicaid benefits. Okay, well then that is when you have to turn to the marketplace to look for a affordable insurance, which is what is provided through the Affordable Care Act, also known as Obamacare, which allows people to get affordable insurance. So there are some people who will have to do that. But what I'm saying is make sure that you don't lose your benefits because you didn't update your information.
Yes. So please go and update your information. It's very important. This is for Medicare, Medicaid plan holders, and especially, I don't know if it's for everybody, but I just put in the chat two things. I put the date that it's going to be ending according to NBC News, and that is May 11th. So today is April 5th. So we're talking about 1 month and approximately a week. So not long. So a lot of people are not aware of this information. I learned this by attending the National Medical Association conference, which is phenomenal organization. And I also put the link so you can read the full news report on this topic. So we're here to provide you all with a lot of information. It is really an honor to have Dr. Wardlaw here. So definitely throw your questions in the chat, your concerns and your thoughts. We're here. Let us know where you're joining us from. And we want to say hello to you. So so let's kind of get into the topic of how stress is impacting our bodies. Did you want to say something before I move on?
Yes, before we move on, Naya, I would be remiss if I didn't say that as we move on and restrictions have been removed, it is up to everybody. It's up to you. It's your responsibility to know what your individual risk is, what your risk is of bringing COVID home to someone else who may live with you, someone who is living with you who's immunocompromised, an elderly family member, a newborn baby, a younger family member. My sister's a pediatrician. She's seen patients as young as 2 weeks old with COVID.
Wow.
So, yes, so you have to take those things into consideration. So again, we're coming across a season where, we're coming up on holidays, proms, graduation.
Everybody's outside.
So we're coming across a lot of large gatherings. So you have to make that decision as to what your risk is or what your family member's risk is to determine if you need to wear that mask or not. And I would be remiss. I have to remind everybody, if you have not gotten your vaccine or your bivalent booster, please do so. Again, the emergency response is ending. So make sure that you do that if you haven't done so. Okay, thank you, Naya.
Actually, I want to say a few more things. So you kind of triggered a thought for me. When I know that I'm going to be seeing my parents, I am very mindful. And I literally have and do alter sometimes my social plans. If I planned on, meeting with a big group of people for a brunch or something else, I know that my parents are going to come visit me in the next 2 to 3 days, I don't do it. Now, if it's the weekend before, then I have time to go get tested and know, my status. But if it's a couple of days, I just don't take those chances. And so I'm very mindful, or I'm more cautious about wearing my mask, even at my normal coffee shop, whatever. So I think we need to really be careful about that. I think we also need to be mindful as we are back outside and we have travel plans coming up and all of these exciting things. May 19th. So if you have not gotten your boosters, we need to be mindful that with COVID, we saw our world get turned upside down in a matter of days, weeks. It's lasted 3 years. So we don't know how this is going to impact the country and the world in terms of our travel access. So I just want to say that if you have not gotten your booster, go ahead and get it while it is covered. While it's covered. So you don't run into a bind when it's showtime, right? And now we can't get into this. And I do global retreats. So I know that countries require certain things. A lot of times they might want to see that you've been vaxxed or that you're tested and all of these different things. And these things change. We know they change week by week, month by month. So just let's all be careful, cautious, and safe on every level. So yeah, I just wanted to share that. I think it's also important. What are one or two biggest myths that you've heard in communities of color around COVID? So for those that are still kind of on the fence and still kind of believing those myths, let's address one or two of those.
So many people say that, okay, why should I get the vaccine if I can still get COVID? The purpose of the vaccine is to prevent severe complications, hospitalizations, and death. And we have seen this work in real time. In 2020, we had several hundreds of thousands of people die of COVID because we did not have any vaccine in place. We did not have any medication in place. It was really, if you caught COVID, you went to the hospital. If you were sick enough, you went to the hospital and you had supportive care. If you had problems breathing, they had to give you breathing treatments or put you on a ventilator. If you had a pneumonia on top of COVID, they had to give you antibiotics. If you developed blood clots, they had to treat the blood clots. So if you had a heart attack or a stroke as a result of blood clots, they had to treat that. So we were pretty much in a supportive care role at that time. So you don't want to take the chance to get COVID because you could get severe complications, wind up in the hospital and die. COVID is still very real. So you want to put yourself in a position to do the best that you can for yourself. And yes, COVID may not prevent you from getting the disease, but the vaccine may not prevent you from getting the disease, but it will definitely significantly reduce your risk of going to the hospital and dying. Also, on top of that, people who have chronic medical conditions, and we know that African Americans are disproportionately affected by many illnesses. We carry the burden of many illnesses. We have higher rates of diabetes, high blood pressure, heart disease, stroke, HIV, renal disease, to name a few. All of those things put you at higher risk for complications and death if you contract COVID. Why take that chance?
Right.
Also, there is long COVID. We know that we're still dealing with complications. Many people are dealing with complications of COVID far beyond 4 to 8 weeks. They have a chronic cough. Some people are on chronic oxygen. Some people have had, it's and to which we will get into later, the effects on our mental status.
Yes.
COVID had a huge impact on our mental status, where the isolation. People were isolated, couldn't gather with their families. People were in nursing homes, couldn't see their family members. People were in the hospital dying alone. Right? And so alone, because no one could go in and see them. And so I say that the vaccine has proven that we have had far significant lower rates of hospitalization and death since the vaccine has been implemented. It works. Vaccines, we have been administering vaccines for years. And again, is it going to cure it? No, but it will prevent you from lower your risk of severe side effects and dying, complications and dying. So that, so yes, you should get the vaccine. Yes, you should get the booster. You always want to have your highest level of protection.
Yes, absolutely.
So, and then another question, and I'm just talking here and the now, well, why do we have to keep getting a shot? Well, because COVID changes. And this isn't the first virus that changes. Guess what? The flu changes every year. And guess what? You have to get a flu shot every year. So that is the direction that we may be going in. It's not uncharted territory. We've been there before. And again, we may have to look towards that. We could potentially have to get a shot every year. And if that's what's going to help us continue to survive and thrive, then we should do that.
Right. Let's be sensible. What's going to keep us alive and thriving and not with, all of these extra complications that we didn't necessarily have to have. Okay.
Absolutely.
So I will share with you all, because I shared that I contracted COVID a little over a week ago. So for me, because I think it's important to hear, for maybe those that didn't get it, right? So for me, it started with coughing, and I haven't had let me tell you all, I'm proud to say I'm pretty healthy, right? So the fact that I started coughing, I hadn't coughed like that, I don't think in a couple of years at least, right? Like it had been a while since I felt this bad. And then the next day I had a fever and I had brain fog and I was exhausted and lethargic and coughing and achy and all those things, like maybe it's a flu. So I went that afternoon and I got a COVID test. But I also went to CVS, to go ahead and get me some flu medicine and stuff, because I didn't know what all it was. And then I got confirmation the next day. So it was 2 days of feeling, I say horrible. And then I went from horrible to very bad to pretty decent. But now I still feel tired. And I pray that this fatigue doesn't last, because y'all know I like to be a woman on the go and a woman on the move, but I'm learning that I've got to give my body rest. And so yesterday I took a nap. Today I got up a lot later and I'm going to bed a lot earlier, because I know that I need My body needs rest to restore. But we just don't know. But I will say that hearing so many others talk about their COVID journey, I know confidently the fact that I boosted my system with the vaccinations and the booster is why it wasn't worse.
Absolutely. And as you speak of that fatigue, unfortunately, that's one of the signs of long COVID. So hopefully you won't experience that. But there are many people out there who have this chronic fatigue as one of the symptoms of long COVID. So
Not
you want to do the best that you can and protect yourself.
absolutely. Absolutely. So let's get into, and this was great. This was timely. So I hope you all appreciated the update, the COVID update, because it's needed, because it's still here. Bam, it's still here. So let's get into even more of today's topic around the impact of stress on our well-being. So talk to us a little bit about that, because we have normalized stress in the United States, and it is killing us and taking us out.
So, stress, and we all have it, right? Yeah, living is stress, right? But stress doesn't necessarily have to be a bad thing, right? Stress is the body's way of giving you those physical responses to let you know that something is awry here, and it's either going to. Sometimes it motivates us to work harder. Sometimes it gives us that that fight or flight response where we know there's a situation going on that we need to get out of here. So stress is not always a bad thing, but if we are exposed to repeated levels of stress and we aren't doing anything to address it, then that's when it can have a negative impact. And we know that stress can affect us physically and mentally. So we need to make sure that we know stress is real. I don't know one person. It's life, right?
It's a part of life. Yes.
It's a part of life. And so we have to make sure that we are recognizing what are the stressors in our lives. Because a lot of times we can't control them, right? Let's just be realistic about it. A lot of times we can't control the stressors. But if we identify them, then we can kind of put things in place to try to relieve that stress. Now, one of my biggest stresses in life is traffic. So all I have to do is leave my house 15, 20 minutes earlier, because that will allow me, if I get stuck behind a school bus or a trash truck, then I don't have to be stressed. Well, guess who doesn't leave 15, 20 minutes early? Me. So if I get stuck, you know what I mean? So, and that's just a simple, a simple example that if you know what stresses you, then try to do something to alleviate that stress. But again, there's some stresses that we have: financial stresses, we have family stresses, we have employment stresses, and also we have this exposure to trauma every single day. We have a gun violence issue in this country where we have so many school shootings. Like, we are exposed to things every day that can land additional stress on our shoulders. So we need to recognize that those things can be affecting us subconsciously. So we need to be able to recognize signs, and it could be something that, it could be fatigue, an inability to be able to get a good night's sleep, an inability to be able to be productive and stay on task. So those are things that stress can affect us. It can have physical features. It can cause you to have a rapid heart rate. It can cause people to sweat. It can cause people to have abdominal pain, which I'm sure I think we're going to get into that a little later. It can cause changes in your bowel habits. Stress can cause a variety of things, and then it can cause depression. And depression is real. It can cause people to have deep dark thoughts. It can cause people to not be able to be productive at home or at work. It can cause people to not be able to do their activities of daily living, can't get out of their bed, can't take care of their children, can't take care of themselves. It can affect their eating habits. And you just jump in at any time, Naya, because sometimes I just
so I'll share this in terms of and you did a great job of unpacking. Stress is everywhere, right? Stress is really the incident of things that we can't necessarily always control. That is a definition of stress. There are three major types of stress. One is called acute. These are short-term events that do not last, but long, but if traumatic, they can have a lasting impact. So that's not something that you're necessarily dealing with every single day. So traffic could be one of those acute stressors. Episodic stress are situations that have they're short term, but we find ourselves in them regularly, like rushing to work, right? So rushing is something that most of us are doing every day. And so that time poverty, that time poverty that we tend to really struggle with.
I like that term, Naya. Time poverty. I need to use that.
Yes, around 70 to 80% of Americans struggle with time poverty because we overmax, we overextend our schedules. Now that we do things Zoom and digitally, we don't unplug. And so we just tend to over maximize ourselves. And that does have an impact, not only on our physical, our blood pressure and things of that nature, but even mentally, not giving ourselves the mental margin. And so workplace causes a lot of stress, but let me give you the third. So there's acute, episodic, and then chronic, ongoing stress that lasts long term. So this could be an illness. This could be a fractioned relationship. This could be, you're going through, heartache. It could be a lot of different things. It could even be, a loved one that's going through, chronic illness, and just even dealing with that care. Work stressors are one of the number one stressors, which is why we created Utopia Global Wellness, to bring wellness into the workplace. 120,000 people in the United States alone die every year from work-related stress. Work-related stress. Some people are, chronically stressed out just from societal pressures, especially for underrepresented people, even not having a sense of belonging or feeling that they are maybe a target of gaslighting and things of that nature. With the work that I've done in the DEI space, I'm very passionate because you cannot have well-being without belonging. It's one of Maslow's hierarchy of needs. Now that we have social media, appearance is something that's causing people a lot of stress. Competition, because now we're always comparing ourselves. And, I heard somebody say this, that a new diagnosis in the mental health space is like attention seeking. That this is really like, it is something tied to attention. I might have to Google it, but this is causing problems for people, like medical, like diagnosable issues. So we just need to be mindful of this.
Can I just say one thing now in regards to social media? It's having a huge impact on our children's and adolescents' mental well-being and health. Significant. Yeah. It's the virtual bullying, that mindset that everybody's life is so great on social media when half of it isn't true. Everybody's life is living their best life, and you feel like you're not able to compete with everybody, and that really is having a huge impact on mental health for our adolescents, for our children, and even for us as adults. Many people spend so much time looking for likes and shares and this, that, and the third, and it really has a negative impact on our mind. And the fact that you mentioned workplace stress, most of us work because we have to work. I mean, let's just be honest about it, right? Exactly. And that is a stressor for many of us. So I am very, very excited to hear that Spa Utopia has this platform where people can partner with you guys through their insurance and get the resources that they need. So thank you for that.
You're welcome. And we evolved. We started as Spa Utopia, but with COVID, the world changed and we did too. And so we knew that we needed to meet people where they were. And this was, creating access to self-care, access to wellness, very affordable, even if you're individual, those individual memberships. And for employers have to care about their associates because their associates are the only way they're going to stay in business, right? And so we're losing over $1 trillion a year in the global economy due to anxiety and depression because all of these things are just mounting. And then we have what's going on in the economy, and we have the financial worries, and then we have the Silicon Valley Bank and the other banks that have crashed. And so, we are just living in a place where we have to be so intentional about investing in our wellness. And people will say, you'll hear in the wellness space that the digestive system, the stomach, is the second brain. And so I know I feel my stress in my stomach, but obviously this is very pervasive because now there's all this talk about gut health. And so being a holistic lifestyle strategist, understanding wellness, understanding the benefits of meditation, understanding the benefits of mindfulness, of yoga, of breath work to create calm and peace all throughout the body. I understand these things, but most people don't really understand why they're having so many challenges with their gut health. So can you kind of connect the dots for us?
So you hit the nail on the head. The second brain,
Mm-hmm.
the mind and gut connection is very intense. The
Yes.
GI tract senses what's going on in your mind. You know that saying, I was so nervous I had butterflies in my stomach? Well, there aren't any butterflies in your stomach, but your GI tract can sense exactly what's going on in your mind. You know,
Mm-hmm.
you're ready to get on a roller coaster, which I don't do. I'm not putting myself in any voluntary situation where I'm scared to death.
Voluntary. I love it. I used to love it when I was younger. Now I'm like, I think
So
yeah,
you get on the roller coaster and it's starting to go up, 700 feet into the sky, and you're thinking like, and your stomach is all in knots because your GI tract senses that. Or some people say, oh, you know what? I was supposed to start a new job today, but I couldn't get out the house because I couldn't get out the bathroom. I had to keep going to the bathroom. So the GI tract is very sensitive as to what's going on in your mind. And there is a syndrome called irritable bowel syndrome, or sometimes people call it a nervous stomach or a nervous belly, where the muscles in the GI tract can spasm, just like you get a muscle in your calf, a muscle spasm in your calf, or you get a muscle spasm in your arm, right?
Mm-hmm.
Those muscles are sensitive, and when they spasm, it can cause a barrage of symptoms. I mean, it can cause a variety of symptoms, whether it could be abdominal bloating, it could be abdominal cramping, it could be pain, it could be changes in your bowel habits, it could be diarrhea one day and constipation the next day. It could be all diarrhea, it could be all constipation. It can cause nauseousness, it can cause vomiting, it can cause a barrage of symptoms. I have experienced irritable bowel syndrome. When I was a medical student, I would get such severe abdominal pain that I thought I was going to die.
Wow.
And it was always the night before an exam. Always
Mm-hmm.
the night before an exam. So it was the stress of the exam. I didn't know it then. And I'm over there worrying my sister to death, like, oh, I got to go to the emergency room. She was like, no, we have to study for this exam. We have to study for this exam.
We got this exam tomorrow.
And what we do know is that the treatment of that, we don't really have any medications, right? It's really all connected to how to identify your stressors and how to relieve that stress. So a lot of it is connected to being connected to a coach, a mindfulness trainer, i.e. Naya and Utopia, or a therapist. And that's another thing we need to touch on. Yes. Naya, the taboo, of seeing a therapist or a psychiatrist. That is okay, because guess what? These are trained professionals who are trained to teach us coping techniques so that we can deal with these stressors that, like I said, we all have them, right? Everybody is different, and everybody handles it in a different way. But that's why we have to be able to utilize these resources. And then, there are foods that can have an impact on the irritable bowel syndrome, fried foods or spicy foods or, dairy type foods. So, there are certain diets that we recommend people follow. But that mind gut connection, it is intense. Yes.
Yeah, it's very true, and I'm glad you talked about the mental health.
Mm-hmm.
That is something that we struggle with a little bit more, also. So it's interesting that the communities of color, and especially African American community, has disproportionately higher rates of almost every disease there is. And even when there are, and I learned this at the NMA, even like for breast cancer, it's not that Black women necessarily have more cases, but we die disproportionately more. So we die from a lot of things at much higher rates. And it's because of the distrust, and it's also the stigmas that we have around mental health. But I want us to understand that our mental health is just, and I would say even more important than even our physical health, because everything starts with a thought. We have to decide what we're going to eat. We have to decide how we're going to move our body. We have to decide if we are going to limit interactions with very toxic people in our life, because all of that, like you said, it starts from feeling stressed and anxious and depressed and hurt and worry and all these things, and it goes right into our body. And so there is that mind, spirit, body connection, and 80 to 90% of death and disease is caused by stress. So we have to learn how to cope. And these trained professionals know way better than our girlfriends and our aunties. And I'm not saying don't talk to the girlfriends, your homies, your aunties, your mom, but they're not professionals. Most of them. There are some that may be, but I'm just saying that there's a both and. Community is important, but speaking to a licensed therapist, and we happen to have one on our team, which is Leslie Stevens Tavera. So she actually provides mental and emotional wellness coaching as a part of our platform bi-weekly. So this is a gift because right now there are therapists that can't even take any more clients because they are maxed out because of the anxiety and depression issues that we have. And I liken it to when I had my car accident a couple years ago and my car was totaled. I had to get ankle surgery. I was not going to try to do my own ankle surgery. And I was not going to go to any of my friends to do my ankle surgery because I don't have I have friends that are doctors, but none are surgeons. Okay. So we need to think about that when it comes to our mental well-being, right?
I will say, Naya, even if your mother, your sister, they're trained professionals, no, you need to go to someone who can be objective. You need to go to someone who can look at the situation and give you an objective opinion and let you know, and unjudgmental, right?
Yeah.
So I wouldn't recommend, even if your mother is a psychiatrist,
Right.
even if your mother is a therapist, your best friend is a therapist, I wouldn't recommend that resource. I would go to them and say, listen, I need to see somebody. Can you recommend me to somebody? But
Right.
I yes, because you have to keep that professional and personal separate. So when my friends come to me,
Mm-hmm.
a lot. Well, I don't treat family because
Mm-hmm.
I tell family, listen. First of all, family, they don't tell you everything. They don't give you all the information that you need, right? So then you can't make a clear assessment because they haven't given you all the information. They're not going to tell you that they're taking Viagra, or they're not going to tell you that they did some risky behavior because they think you're going to judge them, right? So
Yeah.
for that reason, and I don't treat family members, but I will be glad to find one of my colleagues to treat you. So I would recommend the same thing for people who are looking for a therapist.
Mm-hmm. Mm-hmm. No, that's real talk. Yes, we need some lines of delineation here. We need to have some separation. So you're absolutely right with that. And so 70, I love to do research. I feel like it's very important to have this information rooted in stats, which is why I always load up the chat with that. But nearly 3/4 of United States population are struggling with gut health issues, 72%, which means it's probably higher, right? Because
Mhm.
everybody, like you said, is not sharing everything and reporting and all of these things. So we know that 72% of the population is dealing with this. And so it's not just caused by stress. A lot of it is, but it's also can be caused by what we're putting into our bodies. Harvard Health did a study and it shows that a troubled intestine can send signals to the brain, just as a troubled brain can send signals to the
Mhm.
gut, as Dr. Wardlaw just said. Therefore, a person's stomach or intestinal distress can be the cause or the product of anxiety, stress, or depression. And so we can see that there is a huge connection. And so thinking about our stress levels, I want to invite you all to think about in this maybe a coaching moment. I want you to think about what causes you the most stress on a daily basis, or even if, because we do have those daily stressors. For me, it is rushing. That's one of my daily stressors. And so, what can I do about it? Dr. Wardlaw says she can leave 15 minutes early. What I have to do is I have to trick myself. I literally have to say, if I'm going to an appointment, I put 15 minutes before as the time of my appointment.
Mhm. Mhm.
And then what happens is I end up sometimes, because I'm an entrepreneur, I'm doing 1,000 things, the meeting goes over, the client calls, all of the things. So then I might end up 7 minutes late. But guess what? I'm really 7 minutes early. And so that has worked for me my last couple of meetings. I'm knocking on the door. They're like, no, we're not ready for you yet. And I'm like, oh, good. I'm early. So you have to learn what it takes for us, right? So I want you to take a moment and write down, what are three things? I love threes because it's easy. What are three things that cause you a lot of stress? What are your three things? Go ahead and write that down. Okay. And then I want you to write down, what are some of the things that you notice about yourself, your body, your mental space? How are these stressors affecting you? So maybe next to those three things, whether it is rushing, you right now? How does that affect you? How does it make you feel? Does it make you feel anxious? Do you feel it even in your intestinal tract? Are you interacting with someone? And that's another thing, learning to be aware of ourselves emotionally, increasing our emotional intelligence. Who are the people in your life that are causing you stress? And like Dr. Wardlaw said, most of us work because we have to make a living. Okay. So we can't quit our jobs because the financial stress, I think, can trump all the other stresses, right? But maybe we think about, do we need to look for maybe a healthier employer or employment option?
Mm-hmm.
Or is there another team or another department? So when I did a lot of consulting work in this space, we had a program where we were teaching Black and Brown leaders in some of the biggest organizations around efficacy. So the power of our choices, which aligns with Utopia living. So being intentional. So where can you be more supported? Because sometimes if we just know we're working a plan, that makes us feel at ease a bit more, right? So think about your work environment, think about your social dynamics. Perhaps it is unplugging from social media, giving yourself a detox day. I know for me, my phone ringing and dinging all day, it makes me feel anxious. So I put my phone on silent or do not disturb for certain periods of time so I can just have mental peace and not have the dinging. And it's definitely on do not disturb when I go to sleep so I can have a sound sleep. So think about those things. Also want to talk about the food that we're eating. We live in such a convenient society that we're eating a lot of super processed foods, foods that don't really have much nutrients. So we can be overweight and malnourished all at the same time. So, Dr. Wardlaw, what sort of foods you touched on fried foods? What sort of foods do you think we need to be eating less of and then more of for our gut health?
So one, and even before we get to food, right?
Mm-hmm.
Making sure we're drinking, water, right? Making sure we're drinking enough water. Two, making sure that we get enough sleep, right? Sleep is, we should be getting 7 to 9 hours of sleep as adults, right? So many of us sacrifice sleep. We just have to do one last thing. We just have to do one last thing. We really should not be doing that because that can have an effect on our mental health too. You're tired, you can't concentrate, you can't focus. So we need to really make sure that we are getting sleep. Food, we need to, and it goes back to the basics, right? We need to make sure that we're getting fruits, we make sure we're getting vegetables, we make sure we're getting fiber, we make sure we're getting protein, Naya, and then we also have to make sure that things that we should be avoiding. Sugar is sugar is no good, right? And so artificial sugars, natural, added sugars, right? Sugars we have to be very mindful of because sugars break down and store as fats, and then it just compounds the problem, right? So we need to make sure that we are mindful. We need to make sure we're reading labels, right?
Yeah.
You don't know what you're eating unless you read the label. You know what's on the label.
Right.
We need to make sure that we are eliminating. We need to eliminate trans fats. That is one thing we do need to eliminate because we do know that has a risk of significantly increasing our risk for heart disease. And there are some companies that have even gone back and removed trans fats from their ingredients. And so we should avoid trans fats. If you look at a product that has trans fats, don't put it back. Okay. And then other things that we need to watch, we need to watch for, saturated fats and unsaturated fats, the good fats and the bad fats. I always tell people in general, when I'm talking, when we were younger, our parents had that can of Crisco on the stove, on the counter. And, you spoon out the Crisco, you put it in the hot pot and it turns into a liquid. Right. You cook your food and then you put it back into the can and then it cools down and it turns into a solid. So we would eat that, but guess what we couldn't do? Put it in the sink. If you put that into the sink, it will have our heads because it will clog the sink. Well, guess what else it does? It clogs our arteries. It clogs our arteries, right? That's right. So we need to make sure that we are aware. So we need to make sure that you are using things that stay a liquid all the time. Olive oil, whether you put it in the pan or whether it stays up on the counter, it is a liquid at all temperatures, right?
Mhm.
So just being mindful of that, making sure that, and I have to go back to the artificial sugars. And
Yes.
there was a study that recently came out that showed that artificial sugars increases the body's uh, clotting procedures, or clotting events, which leads to a higher risk of a cardiovascular event or heart attack or stroke. So these
Mhm.
artificial sweeteners, the diet drinks, the um, I'm blanking out on a couple more that you add these artificial sweeteners to your coffees, to your teas, and things like that. Please don't.
Yeah.
Okay, so it is no good for you. Okay, so, and then be mindful of the natural sugars that we talked about as well. So it really all goes down to um, knowing what you're putting in your body, and knowing that it can definitely have an effect. Making sure with your gut health, and sometimes dairy products wreak havoc on our wreak havoc on our gut, unfortunately. And
Mhm.
if you're noticing that, then you have to scale back and look at it at a different option for you.
Mhm.
Fried foods, spicy foods. So, and those things are not just for gut health; those are for overall health and in
Overall health.
general. Yes, absolutely, absolutely.
Absolutely. So we also, there's a certain foods that really contribute to unhealthy bacteria in our gut, and then there are ones that are more that help to balance out the bacteria and the healthy bacteria in our gut. And so I do know that garlic is really good for gut health. Ginger is really good for gut health, along with whole foods, grains, fruits, vegetables, things that are high in fiber. So I just wanted to share that. And just broadly speaking, anything that is high in saturated fat, high in processed, high in those refined sugars, and then even the stevias, because I was thinking that stevia was a lot better for us, so I was doing stevia, but that really throws off our insulin levels, and our body doesn't always know the difference between those and others, and so we do have to be very, very careful and just really sticking to more of the natural
Mhm.
processed foods, whole foods, as much as possible, which is totally counter to Western diet, right? So this contributes to us being, one of the more technically advanced societies, but also the sickest.
Mhm.
We need to be mindful of that. The way that we work and grind and the burnout, also our happiness levels are continuing to decrease over the last 10 years. So
Mhm.
there's a lot that we want to reevaluate, and again, this is what Utopia Living is all about. So I just want to get ready to close us out. And just, if you could share, maybe something you would tell your younger self that's on their journey of trying to figure out if they want to pursue a field of medicine. What would you tell your younger self or someone that is younger and watching?
So a couple of things. One, know your why, right? Because yes, a career in medicine is a great career, but it's a challenging career. The
Mhm.
days are long, the years are short, but and the time passes very quickly. However, it is a very challenging career. It has to be. You have to know your why. So
Mhm.
my why was, helping people to not die at a young age, as my grandmother did. So it can't be anybody else's why. It has to be your why.
Mhm.
Two, be mindful of your resources. Find a mentor.
Mhm.
Three, make sure that you are strategically choosing your place that you go to college, right? So very quickly, I knew that I wanted to go to medical school, and I had dreams of going to an HBCU. So
Mhm.
I applied to all HBCUs,
Mhm.
and I applied to one safe school, Temple University. And I always say Temple chose me
Mhm.
because Temple was the one who gave me the funding. I knew that my parents could not, or my parents are great. They advocated for me to get the best public school education that was offered here in Philadelphia. I went to the best public high school in Philadelphia. That's Central High School for anybody who's watching. And and so I say I had to choose wisely. My dream of going to Spelman College went down the drain when they sent me a package for $500. I couldn't even get to Spelman for $500, right? So
Mhm.
I went to Temple University. My parents said, you can live here for free. They gave us a car. And guess what? I was able to leave Temple with barely any debt at all. And then
Wow.
I went to Penn State Medical School, So a state college, I was a Pennsylvania resident, I went to a state college, and I was able to get funding for those reasons. So be mindful. School debt is crippling, and you know they're doing some things now to try to help erase some of that debt. Be mindful of where you go to school. Now, unfortunately, some people, you get into one medical school and that's the one you go to, right? So, but you know, you have to make sure you're looking at all the resources that are available to you. So that's.
Would you like to share maybe a organization, kind of like you had that opportunity for those 8 weeks during the summer? Any organizations that you know of that, you know, young folks can look to for summer programs or mentorship or anything like that?
So one, I would say definitely look at the National Medical Association. They have resources. To look at your local chapters. Like I said, we have the Medical Society of Eastern Pennsylvania here. Make sure that you know the sororities and fraternities, historically Black sororities and fraternities. They oftentimes have resources. You know, they have scholarships that are available to students who are interested in various areas. And so you really just have to do the work. You have to, and social media, not social media, the internet has made it easier, right? So we used to have to go to the library and look up these scholarships and what was available.
Don't make you sound so old.
Listen, that's the reality of it. So, you know, technology allows for you to go home and do that in your living room, right? And please make sure that you are talking to your college your school counselor, your college counselor. Unfortunately, many of us are discouraged from going into medicine. Oh, that's not for you. Maybe you should go into this career, go into that career. And then that's when I say you really have to reach out and find somebody else who's going to help guide you.
Yeah. And we have a lot of Black doctors that are leaving the field. And so I know COVID has really exasperated the medical community on every single level. And I just want to say we need you. And I know it's not easy, but I do want to encourage you all to stay in the game. You know, all of our physicians across the board, and especially our physicians of color and our Black physicians, because there is a distrust, and we need to see people that look like us, you know, and that's for everybody. You know, you just tend to feel like people get it. They understand you more when they see people that look like them. And that's that sense of belonging. And we need that in the medical field. And I know that there are a lot of challenges there as well in terms of diversity, equity, inclusion, and belonging. But I want to encourage you to, you know, before you leave completely, maybe try to find institutions, hospitals, and places that will support you, you know, before leaving completely.
Absolutely. And so diversity is a big issue. African Americans make up 5% of the physician population here in the US. African American females make up 2% of that physician population. So again, that is why part of the Twin Sister Docs mission is to reach back. We do a variety of reaching out platforms, whether it's talking to 3-year-olds, 5-year-olds, high school students, high school students, middle school students, whether it's college grads, whether it's people who are in transition between, because there's some people who don't go straight to medical school, some people who choose medicine as a second career. So we use our journey to be able to reach back and bring those along that we absolutely need.
Absolutely. Absolutely. So we're going to transition into just maybe a moment of mindfulness, because this is something that you can do no matter where you are. It doesn't have to be a long process, but it's a practice that you can do on the go, even before a meeting, just even if it's for 1 or 2 minutes, that can really help to create more peace and harmony in the mind, body, and in your digestive tract as well. So I'm going to invite you to put one hand on your heart, one hand on your core, your center, and you can close your eyes or lower your gaze, whatever is most comfortable. Let's make sure our feet are planted firmly on the floor. We can go ahead and relax our shoulders, even relaxing your jaw. Sometimes we're holding tension even in our mouth. And taking in a nice cleansing breath, breathing in through your nose, slowly exhaling. You can exhale through your mouth or your nose, whatever is most comfortable for you. And again, breathing in through your nose, breathing in peace and harmony as you fill up your abdomen, your lungs, your belly, slowly exhaling. And again, focusing on our stomach, our digestive system, just breathing in health, harmony, and peace. Exhaling and releasing any stress or anxiety. When you're ready, you can open your eyes. You're invited to put how that made you feel in the chat, even if it's just one word. And it only took about a minute and a half. So I want to leave us with this quote. For everyone, well-being is a journey. The secret is committing to that journey and taking those first steps with hope and belief in yourself. I also want to invite you to do a free trial with us. Enjoy self-care and wellness classes that are available anytime, anywhere. We have live classes 5 to 6 days a week. And then we also have our wonderful classes on demand, over 500 of them, including mental health, emotional coaching, and nutritional coaching. So we have a little something for everyone. And of course, the other classes we mentioned and workplace wellness workshops. So thank you so much for joining us. Dr. Wardlaw, this was really a treat. You have been all over the airways and in the press. And so to have you on our platform has been really an honor. So thank you so much. And if there are not any final words, we'll say.
I would like to say thank you for having me, Naya, and I would like to say congratulations to you and Utopia Global Wellness, because you're doing phenomenal things. Mental health is the key to us being healthy overall.
Thank you. Thank you so much. You all, please let us know how you enjoyed. Share this on your LinkedIn, your Facebook. I believe that this will be so helpful, beneficial, and a blessing to all. Thank you, and make it a Utopia living evening, and see you soon.